guys, my name is Nick Lowe and today I'm going to show you some really effective exercises for foot and ankle mobility, flexibility, strength and balance. Now these exercises are often a commonly overlooked part of any kind of fitness and rehab program, but they nonetheless remain a really important part of our fitness and functional health. It's especially important to have strong, stable and well-balanced feet and ankles as we get older to help prevent the risk of falls. These exercises are especially useful if you've got a history of ankle or foot injuries, whether you've had broken metatarsals, broken ankles, a lot of sprained ankles, you've rolled over on your ankles before in the past, and especially if you've got an imbalance between both feet. You might have injured one foot and then developed a compensation pattern on the other foot, and there's imbalances in both sides. So these exercises can really help bring your body back into symmetry in terms of balance, stability and mobility. These exercises can be also very useful for treating plantar fasciitis and should form part of any kind of plantar fasciitis rehab program you might be going through. Now there are some other specific things we need to do for plantar fasciitis as well that I'm going to cover in a separate video, so I'll make sure I link to that below so that you can check that out as well. But without further ado, let's go on to the flexibility and mobility part of the exercises, starting with the feet and the ankles and really just looking at some basic exercises to start with and then progressing on to more challenging flexibility and mobility exercises. Let's start with the first and most simple mobility exercises for the ankle, which is just a rotation. What we're going to do is we're going to lift one leg, keep it nice and straight, and we're just going to rotate the ankle like so. Nice and slowly, nice controlled movement. And we're going to do about 10 rotations each side, and then we're going to change. And you're probably going to notice that rotating one side is a lot easier than rotating the other side. So these exercises are really good to just iron out those imbalances. After we've rotated, we're then just going to extend and flex. Extend and flex. Making sure again, slow, controlled movement, keeping this leg straight, really pointing the toes on the extension and really pointing the toes back towards you on the flexion. Nice, slow, controlled movements. You're actually going to feel this working the tibialis anterior, this muscle, a little bit as well. So you're going to get a little bit of strengthening action in the tibialis, which is very useful and quite a tricky muscle to strengthen effectively. Again, do about 10 or so to start with before changing legs. And again, exactly the same on this side. Start with rotation. The other thing you'll probably notice, foot to foot, there are a lot of differences. Change direction in the amount you can rotate, the control you have over your feet and ankles. And then extension, flexion, extension, flexion. Nice and slow, nice and controlled. Again, you're going to feel the tibialis muscle contracting on the flexion and the calf contracting a little bit on the extension. So now that we've done the exercise lying down, we're going to repeat and do exactly the same, but this time standing up, so that we're basing and balancing on one leg whilst we're performing the mobility exercise. So just like before, we're rotating the ankle one way, we're rotating the ankle the other way, and then we're going into flexion and extension. So the exercise is the same, we're just doing it standing up. And this way we get to challenge the balance and the stability of our base leg whilst also improving the range of motion and the flexibility and the mobility of the ankle that we're moving around in the air. As you can see, I'm balancing, I'm helping support myself using a table. This can be any support you need, a wall, table, chair, it doesn't really matter. Use something solid
to support yourself, as this can be quite challenging at first. You might be recovering from a particularly bad ankle injury or have quite bad compromised balance, so really use all the support you need to start with this exercise. Eventually, of course, the idea is that we want to challenge ourselves to let go of our support and be able to do this exercise free balancing on just one leg whilst we're moving the opposite angle. Don't be in any hurry to get here, and make sure you use all the support you need if necessary to prevent yourself falling over.
So now we're going to look at some sitting positions, some kneeling positions to stretch open the ankle joints and the soles and the plantar fascia of the feet. So these are positions that really we should be natural and comfortable in, but a lot of the time, due to modern lifestyles, we're not used to sitting on the floor all the time, we're not used to kneeling so much. So we've lost some of this natural flexibility and mobility. So the first kneeling position is like this. And in this position, our feet are fully extended. My legs are flat to the floor. Now ideally we want to sit in this position comfortably for up to 5 and 10 minutes, potentially longer if we really need to. And this should be natural and comfortable. Now, if this is a challenging exercise for you, I'm going to show you some ways that you can progress to eventually be able to sit like this comfortably. So as you can see, I've put the yoga mat under my ankles, and this has decreased the angle, it's decreased the stretch and the extension that I'm going to feel on my legs and my feet and my ankles. Now, what you want to do is just gradually decrease the level of padding you've got under your ankles over time until eventually you no longer need the support and you can sit like this comfortably. Another really important kneeling position is sitting on the balls of our feet, like so. Again, this is a position we should be naturally comfortable in, but due to modern lifestyles, often this is very difficult, especially on the base of the feet here around the toes. So, again, there are progressions and ways we can make this an easier position to sit in. So as you can see here, I've used some yoga blocks to decrease the angle and decrease the intensity of the stretch on the soles of my feet and the plantar fascia. And the idea is that you just gradually sit and become comfortable in this position, and eventually keep removing these blocks and making it more challenging as your feet and ankles start to get a bit more mobile. And again, keep removing the blocks to make it even more challenging. Really take your time with this, there's no hurry, and it may take you a few weeks, it may take you up to a couple of months to really get this mobility back to where it should be, but eventually this is the ideal comfortable position to sit in, and a nice natural position to really open and stretch the soles of the feet, the toes and the plantar fascia. Now, a particular range of motion that causes a lot of people a lot of trouble is ankle dorsiflexion. So I'm going to demonstrate what that is here. It's the ability for our knee to travel over our toes. So it's the flexibility here at the back of the Achilles, but it's also heavily related to what's going on at the front of the ankle joint as well. So we're going to show you a couple of exercises to really help with this type of mobility here, which is especially important for squat mobility and important for other movements as well. So to start with, again, just taking some kind of support. This can be a table, a wall, doesn't really matter. And first, all I want to do, again, we're focusing on this front leg, is just bring that knee as far over the toes as you're able to. Now, it may not be able to go very far to start with, that's okay, it doesn't matter. Just relax into the position, keep repeating it, and eventually this mobility will improve quite quickly, especially if you're not used to doing this kind of thing before. And again, the support with the hands here is really so I can lean some body weight into this, to take the weight off my leg a little bit, to allow it to relax easier into the position. Hold for a minimum of 30 seconds, ideally upwards of about a minute on each foot. And change legs. So again, exactly the same. Make sure your weight's supported, your hands on a table or a wall, doesn't really matter, and just gradually start to bring this knee over the toes, like so. And again, very normal for you to have one ankle that's going to be a lot worse than the other. So again, really important to iron out the imbalances on both sides. And if one ankle is worse than the other, is more stiff, is more difficult to get this knee over, just focus on this one for a longer period of time, or double it up, do another repetition on the bad leg. So now that we've looked at ankle dorsiflexion from a standing position, we're now going to look at a bit more of a challenging exercise on the floor to really push the boundaries and increase this range of motion even further. This stretch is also very good at affecting and stretching the hip flexors on the rear leg. So let's go into the position and I'll show you what I'm talking about. So again, this front leg is exactly the same. It's just we're kneeling and we've got this rear leg stretched out in a lunge position behind us. Now this is somewhat of a difficult mobility on its own right, so you might find this particularly challenging. If so, just stick with the first exercise, but if you're capable of getting into this lunge position, this is a really effective position to work on ankle dorsiflexion. So again, I want you to start with some support. Again, table, wall, doesn't really matter what it is. And what you want to do is you just want to walk the rear knee forward to where it's comfortable. And again, just let this knee travel over the toes here, closing this space and allowing the muscles of the Achilles, and also you're going to feel potentially a stretch pulling underneath the foot into the plantar fascia. So again, this is one of my major rehab exercises if you're suffering from plantar fasciitis. And again, as I mentioned before, you're going to feel a nice strong stretch on this hip flexor as well, so sort of added bonus. Again, really holding this stretch for a nice long time, letting those muscles relax, soften into the position. And again, if one leg is particularly worse than the other, spend more time on it, or do an additional repetition of that leg to help iron out those imbalances, those asymmetries in your ankle mobility.